Well, welcome back to Senate Doctors. I'm John Barrasso, a United States Senator from Wyoming, but also an orthopedic surgeon, and practiced in Casper, Wyoming for the last 25 years, board certified, and now we're on our 5th episode of this Senate Doctors show, if you will, and usually I'm here with my friend Tom Coburn, who's a family physician, obstetrician, delivers a lot of babies in Oklahoma. He is also a United States Senator. There are only 2 doctors in the United States Senate, and this is all in an effort to give you information about what's coming up in the discussions on health care reform and legislation. Tom is actually right now, and we're live on Thursday afternoon, 5 p.m. Tom is on the floor of the United States Senate. I'm hoping he's going to be able to join us down here, but he's speaking on the floor of the Senate right now. But the whole idea of this is to give you information, try to answer your questions. We have emails, video questions, questions that come in on Twitter and YouTube and Facebook. And let's go to a question right now. Let's see. I recently retired and will be eligible for Medicare in 3 years. I am scared to death with what I hear this administration is trying to do with health care. I believe reform needs to happen, but not this way. Can't the problems with the existing system be dealt with without the government taking things over? And that's Christina from Cheyenne, Wyoming. Well, Christina, thank you. I was in Cheyenne last week for the rodeo, talked to a lot of people in Wyoming, had an opportunity to visit about things, and this is a common question because she's going to be eligible for Medicare in 3 years and has great concerns. We hear about the fact that there's going to be cuts, that the President talks about savings, but people know that means cuts. $500 billion in Medicare cuts, and the question is, what is that impact going to be? What's that mean for people all around the country? And they're talking about making those cuts so they can then pay for people who don't have insurance. And I don't think our seniors are going to stand for it, because I have the same concerns you do, Christina. My worry is that if this all comes to be and it makes it that much harder for people on Medicare to get to a doctor, to be seen by a doctor, because we know that that's an issue right now, that this is going to not be an improvement. And that's my concern with all of this. I think being rushed into making decisions. I know the President had said, hey, I want to have a bill out of the House, out of the Senate by August. I think he is now today in Cleveland at his speech at the Cleveland Clinic, said, and I'm happy to hear him say, I want to get it right instead of getting it done fast. And to me, that's what I've been saying all along. We want to get it right. We do need health care reform. We need to do a better job of actually taking care of people and focus on a health care system instead of a sickness system, which is the system we have now. But I believe that we can have reform without having the government take over more. The government doesn't do a good job in the things that it does right now. Medicare has the most fraud and the most abuse and the most waste of any medical system that is out there. So the more we can do to focus on individual responsibility, trying to keep people healthy, and trying to work that way, I think it's better than trying to just have more government involvement. And if you want to ask a question, we want to hear from you. Best way to do that? Email us right now, doctors@src.senate.gov, or you can leave questions at youtube.com/user/Senate Doctor Show, Facebook at facebook.com/Senate Doctor Show, or Twitter at twitter.com/Senate Doctor. So we'd love to hear from you. Please just get in contact with us. We'll try to answer your questions. And we get a lot of questions, but please let us hear from you. And now we have a question via Twitter, and the question is, let's see, I like my health care coverage now through my employer. What will happen if I change jobs? I'll tell you, this is a big question and a big concern. And I think what we need to do is make sure that your health care is portable. It's your health insurance, and that you should be able to keep it no matter what job you did. I have 3 kids, 1 in high school, 2 in college. If you just kind of take a look at the statistics, they're going to have 7 or 8 jobs over the time between when they finish their education and when they get, maybe retire. And when you look at that and say they're going to have that many jobs, wouldn't it make more sense if the insurance was owned by the individual instead of it getting connected to your job? And especially with pre-existing conditions where you're kind of sometimes strapped to the job, can't leave the job because of your pre-existing condition, because you'll lose your insurance if you try to get either start your own business, work on your own, or go to another place where maybe they don't offer insurance, and you're going to have to go buy insurance on your own. So absolutely, we have grave concerns about when you are stuck with the insurance that is tied so specifically to your employer. Now, you know the story as to why so much insurance in the United States is tied to the employer. It has to do with World War II. Back then, with frozen wages because of the war, they couldn't pay you more. They couldn't give you a raise. But what they could do is give you a benefit, and the benefit was health insurance. And then the government said, okay, it'll be tax deductible. Well, as a result of all of that, insurance is a lot cheaper if you get it through work because they get a tax deduction. Well, I think anybody that has their health insurance and buys it even personally ought to have a right to take that deduction and take it off. Take that as a deduction from their personal income tax. That way it would be cheaper for you in terms of your pocket dollars, because I think people are very wise when it comes to their own health care dollars, but aren't as focused on insurance companies or government spending, but it just makes sense. So absolutely, we need to have portability, and I don't see it to the degree that I would like it yet in the bills that we're taking a look at. I think now we have a video question coming in.
First question is regarding health care networks. We've got to make sure, please, that community providers are part of the conversation, part of any network. So my first question would be, are community providers going to be part of any health networks?
Community providers need to be part of any sort of a network. And we need medical homes for people, places where people can go for their care, where they start their care. And in a community, I mean, it's not just a doctor. We need the nurse practitioner, the physician assistant, all of those folks in a community. Because look, I'm from a rural state. Wyoming is very rural, and we have special needs because the distances are so far. We have 23 counties, but in those counties, they're very spread out in the sense that it's 100,000 square miles, only 500,000 people, and there are a lot of states where even though you may have a big city, certainly in the Rocky Mountain West, the distances between those cities and where people are out on ranches and farms all across this country. And that's why we have some bipartisan health legislation that we've introduced to focus on rural America, rural communities, to try to answer those questions, because we need to get health care being affordable, we need to have it available, and making sure that community providers are involved in that. And then the other part is telemedicine. By using the technology, with computers, with video, with uplinks, the technology, so that even though somebody at a great distance isn't right near a physician, but those community providers can be linked to those folks, and in that way get more information. We do it now with x-rays. I did it in my practice in orthopedics in Casper, Wyoming, where somebody might be in a smaller community hospital, and they'd through telemedicine, I'd get a chance to look at that x-ray. You can do it actually at home on my computer, and then you can make the decision, do we need to send the helicopter for that person? Can they come by ambulance? Because the distances are great. So we need to get community providers very actively involved in whatever healthcare system we have. Next we have another email question. This is from Bob in Bristol, Rhode Island. Bob said, why is tort reform not part of the health care legislation now being considered by Congress? What would be the impact of eliminating frivolous malpractice suits? Well, I'll tell you, Bob, for people that watch this closely and who look at the bills and that are out there, the House bill, which is a very thick 1,000-page bill, I have a copy of it right here. There is you go through this entire bill, look through the whole thing, read the whole thing. There is nothing in this entire House bill that Nancy Pelosi is trying to get passed, nothing that deals with any of the things that you're looking at in terms of tort reform, in terms of junk lawsuits. There is nothing in there at all. But you and I both know that that is a cause of significant amounts of expensive tests being done, ordered by doctors, because there are two ways that things in this system are so focused on doing things, and that's how hospitals get paid, by doing things. It's how doctors get paid, but it's also how doctors protect themselves from lawsuit abuse by ordering more tests, another MRI, another CAT scan, to make another blood test, another chest x-ray. And that raises the cost of your care, but it doesn't actually get you healthier. It just makes the doctor feel more comfortable that, gee, I didn't miss something, because what happens if this patient has a complication, and I want to make sure that I did everything right. So it adds significantly. It's not in this bill, it's not in the Finance Committee bill, it's not in the Health Committee bill. You know, Senator Enzi, who's the other senator from Wyoming, he tried to just introduce a pilot program on medical courts, just to see, you know, would that work? Because, you know, we have specialized courts in this United States right now on copyright law, on another number of areas, so that there's some uniformity. Because one of the concerns, as you know, is that if there is a suit filed, and if the person is deserving and needs to be cared for, it takes too long to get it right. And about 60 or 65% of the money in the system doesn't go to the injured person. It goes to the lawyers on both sides and the expert witnesses into that system. So it takes too long, too little gets to the injured person. So I think that medical courts that could come in much more quickly and come up with a solution and say, yes, something needs to be done, this person needs to be compensated, I think it gets them more money quicker than with the system that we're dealing with now. Now, now we have another question coming in by email. This is a question. It said, during our discussion on Morning Joe, most agreed that Congress should pass comprehensive health care reform. Since taming the explosion of health care costs is necessary to save the system, what major steps do we make to curbing that trend? Do you agree that rationing in some form is necessary? And how do we stop spending a quarter of our health care dollars on the final year of patients' lives? And this is from Mika Brzezinski of MSNBC's Morning Joe. Mika has been asking very thoughtful questions about this, and I agree with her. Major health care reform is necessary. It's not something we should rush to do. We need to get it right. You're talking about 1/6 of the entire budget of the United States. 1 out of every $6 we spend in this country is on health care reform, is on health care, and we need to get it right. And we need to get it right in a way that is sustainable, that lasts. It's not just something that's quick, because the Washington Post had an editorial today, Mika, that, and I'm sure you've seen it, where it questions the fact of, will this be sustainable, or is it just going to be gimmicks, financial gimmicks, to try to pay for this? Their other concern with the Obama proposal is that it actually doesn't get costs under control. We need to get costs under control, and we know there's a lot of waste in the system. We just talked about the number of tests that are ordered, more to protect the doctor from a lawsuit than actually help the patient get well. There's huge amounts of waste and fraud and abuse in the system, but we need to focus on wellness, on getting people well, giving people individual opportunities to stay healthy and keep down the cost of their care. It's not enough, as the Kennedy bill does, to build bike paths or walking paths and jungle gyms and put up street lights so that people in a community may get out and exercise. You need to give the individual the incentive to stay healthy. That person who's 20 pounds overweight and as a result is diabetic and has high blood pressure, because we know chronic diseases cause so much of the cost. We know that half of all the money we spend in healthcare is just on 5% of the people, and those are people that eat too much, exercise too little, and smoke. And then you get to that very important question of those final days in a person's life, the final year, but also the final days, which can be very expensive. And most expensive if that person is in an intensive care unit, and if that person has not in any way come out and said what their final wishes were. And that's why I think it's so important to go out and have people state those things, whether a living will, a durable power of attorney, something that says this is what I want done. Because as a doctor, people would come to me when mom or dad was, an older person in the hospital, in an intensive care unit, and they never really had that discussion with the family. They don't have the document, the living will, without that dedicated answer to what mom or dad would want. So I think that would help a lot, because it gets very expensive in an intensive care unit, and the more we can do to involve family members and let everybody in the family know what grandmom or grandpa wants, that's going to help us as well. Now I think we have in a couple seconds we have another video, but before we do that, if you'd like to get in touch with us, we would like to hear from you. You can email me, doctors@src.senate.gov, youtube.com/user/SenateDoctorShow, facebook.com/SenateDoctorShow, or twitter.com/SenateDoctorShow. Now I think we have a video from Mike from California.
Yeah, I think making it private or making it a healthcare system run by the government's a very bad idea. Because I work in the healthcare industry now, and right now it's pretty common knowledge that the Medicare funding, we're going to run out of it even faster than we run. It's more in dire straits than the Social Security money right now. And he was saying that government oversight does a good job of running the system, and that's not true. That the system is generally running out of money, and having the government run it, with a lot of the systems that they run, generally the oversight and the way we spend money and the budget crises that we're continually under are just going to add to that. And the Canadians have a system of government-run healthcare now, and they have a tax rate of about 50%.
Well, Mike, you asked a lot of questions in there, and I think you made a lot of very good points. And the one is you talk about running out of money. I mean, right now we're looking at a federal budget that's going to double our national debt in 5 years, triple it in 10 years. We've had a stimulus package, which to me did not really do what was promised. I voted against it. I know Senator Coburn did as well. But I have to tell you that I have grave concerns. And then you talked about Medicare and what the government is trying to do there. We are facing a wall of debt. So when we're looking at a health care proposal where they say it's going to cost an additional $1 trillion, add additional $1 trillion to the debt, and you look at that high cost, and then they do the numbers and you see that it covers too few people, and it kicks too many people off of the insurance that they have that they may like. You say this isn't the way to go. And then the other thing in this big 1,000-page proposal, they're trying to get more and more people onto Medicaid, the other federal program that they have a shared responsibility with the states. Well, that is an awful program. It doesn't do anything, in my history of practice in medicine for 25 years, to control costs. It doesn't do anything to help coordinate care. It doesn't do anything to help with prevention or to give incentives to people. It's first dollar coverage. It pays very poorly, but it starts at the first dollar. These are folks that need additional help, and that is not the way to do it. And then the governors all around the country are very scared about that also, Mike. They had a meeting just past weekend, the National Governors Association. They were in Mississippi, and they have grave fears, and there's a New York Times story, front page story, New York Times last Sunday. Governors fear Medicaid costs in health plan. The nation's governors, deep concern, expensive new Medicaid obligations without money to pay for the plan. So the worry there is, even if the folks in Washington come up with some gimmick to say, oh, we're not going to have to pay for all of this, and yet there's no such thing as free. That if they come up with some gimmick to pay for it, they're going to do it by pushing an unfunded mandate on the states. And there's been a lot of backlash from governors, Republicans and Democrats, and that's why we're fortunate. We have a number of former governors who are serving in the United States Senate. I think of Lamar Alexander, who's been governor of Tennessee. Now he's a Republican. He knows his stuff on that, and he says, boy, that was one of his biggest headaches. Governor Johans from Nebraska said the same thing, Medicaid being a very big challenge. But it's not just that. You can read from the governor of Montana, the governor of Tennessee. The governor of Tennessee, a Democrat, said this is the mother of all unfunded mandates. He also went on to say Medicaid is a very poor vehicle for expanding coverage. Governor Gregory of Washington, another Democrat, said that this is a cost shift to the states and that we're not going to be able to be in a position to pick up the tab for all of this. Bill Richardson, governor of New Mexico, said, I'm personally very concerned about the cost issue. Governor Bill Ritter of Colorado said, hey, this is going to fall on the states. That's why we need to not rush. We need a sustainable program that's going to work. We need a whole new system that is going to do what we need to do to keep people healthy instead of just focus on putting all the money into sickness, because that's what the system is now supporting. So I appreciate your comments, Mike. We're going to work very hard to make sure that we can get a program that works, that actually gets the costs under control, but I'm not seeing that right now. And now we have a question from Twitter. This is, has the timeline for markup and debate been pushed back until after the August recess? And this comes in from Terry. Thanks, Terry. Great question. Just today, we are hearing for the first time that it looks like things are going to be pushed back beyond the August recess for voting on the floor. You asked about markup and debate. I think they're still continuing to try to mark up the bill in the Finance Committee. Nancy Pelosi said she's still ready to have a vote in the House of Representatives. My concern is this. You take a look at this bill, and I say before the House members ought to vote on this bill, what should they do? They should read the bill, and then they should go home and talk to people, and not just talk to them, then listen to the people in their own home districts, and then come back and vote after they've had input from the people at home in terms of what is the impact going to be of this on the lives of the people, because healthcare is a very personal thing. It is the most personal thing in your life, and what you need to be able to do is think about it, make good choices, and say, is my life going to be better or worse from this bill? That's what we really need to do, and that's what I think Americans all around the country are asking at the, as they sit around the kitchen table. So, but until they have a chance to see the bill, until folks see the bill at home and read it and think about it, I think they shouldn't make any votes, because the Mayo Clinic just said, hey, this is not a good bill. It's not good for health care. It will make matters worse. It is the bad, and is not a good prescription. It's the bad prescription for patients. So hey, we're going to do this every Tuesday and every Thursday. Hopefully Senator Coburn will be with me next Tuesday. We're going to move the time to 5 o'clock, 5 o'clock Eastern Time. We want to hear from you, but please tell your friends. We want to hear from you, and we want your questions or through Facebook, or Twitter, YouTube, or just email us directly. We love to hear from you. Thanks so much for joining us today on Senate Doctors.